Thank you all so much for being here. Can people hear me all right? Yeah? Good. Okay, I'm using my professor voice as best as I can, but there will be no equations. I really want to thank you all for coming. I know this is probably not something any of us planned for today, this particular conversation. It's a difficult conversation, and it's a really important conversation. I think it's a conversation about keeping our students safe, which is the most important thing that we do. We're here today on this particular day because of something that's been in the media, a situation that's been in the media involving a Williams student, and that's a really good reason for you to be here. I think it's also really fortunate for me that you're here because this is work, as Wendy said, that I've been thinking about for 4 years since the day I became dean, and has really been the focus of my 4 years here. And so I'm very happy for the chance to tell you about what we're working on, how we're working on it, what we understand about what's going on at Williams, and particularly about the work ahead. Everything I'm going to be telling you about today is parts of ongoing work, right? And it's really, I think, in many ways, work that we do to try to make this institution worthy of its students, and worthy of their respect, worthy of their stories, worthy of their trust. So that's what I want to talk about, and why I want to talk about it, and why I'm grateful that you're here. I think part of the reason this is such an important subject is that it's one where our responsibilities to our students ethically are as deep as they could possibly be. And we're also working in a really rapidly changing national environment, a rapidly changing legal environment, where our ethical obligations and our legal obligations come together in the care of our students. So we're going to talk about sexual assault. And this is a hard subject. People in the room will have had different experiences with this subject, with talking about it in their own lives. I just want to say to begin with, if there are things that I'm talking about that are hard for you to hear and you feel like you want to take a break, that's also fine. So sexual assault is, as we know, a major source of harm to students nationally, on college campuses and off college campuses, as well as at Williams. And really, I'm going to say a lot of things today, but they all boil down to one thing, which is that it is my job to do everything I can to reduce that harm. And that job has different parts. Part of it is about stopping sexual assault from ever happening on this campus. We try to do that through education, through awareness work, through prevention work. There's a lot about that. I'm going to talk about that mostly towards the end of the talk. And then reducing the harm has this second part, which has to do with taking care of students who have experienced assault, whether they've experienced it here actually or elsewhere, but responding to them in ways that give them the strongest recovery, the best care, and the most experience of safety that they can have on the campus. So I want to talk a little bit to start with about what we know about assault at Williams and nationally and how we know it, and then some about how we're working to reduce its impact on the lives of students here. And as I said at the beginning, and I'll keep saying this, we're in the middle of this work. This isn't some sort of declaration of victory. This is a conversation about ongoing work that we're in the middle of. Before I really dive in, I want to just say one other thing, which is that all of the work that I'm going to describe is part of an arc that's much longer than my time here as dean. Many of you, perhaps when you were here, thought about issues of this kind. Many of our students have been deeply involved in improving our support for students, our prevention work, and our adjudication and disciplinary processes, and I really want to give them credit as well. So I'm going to start with just a few terms so that we're all using the same words in the same way, because the terminology in this field can vary a lot contextually. So what I'm going to be talking about is sexual assault, and sexual assault is a broad term that describes any sexual contact that happens without the active and clearly expressed consent of both parties. So it's a broader term than you might see in the criminal law. In criminal law, for many states, you see words like rape, and sometimes those are involved, particularly in their definitions, with force, not always. But those definitions vary from state to state and from place to place. The thing we think about at Williams when we talk about sexual assault is this core principle that sexual activity should only take place with clearly expressed, specific consent and agreement of both parties. So it's broader, but I think it also really contains our core values as an institution, right? Our core values as an institution have to do with how do we treat one another with respect? How do we uphold one another's integrity? How do we do that in our public lives? And also, how do we do that in our private and intimate lives? It's a broad definition. So that's the word that we're going to be using, sexual assault. So I want to talk a little bit about how often sexual assault happens on college campuses, for example. And I'll be talking about survey data in particular. That has to do with asking students anonymously what their experiences have been on campus. And I think one of the things that's really been benefiting from this larger national conversation is colleges as a whole doing a much better job of thinking about how do we ask about this? How do we find out honestly what's going on in our campuses that might be hard to hear about, that might be difficult to look at? How can we learn about those things? And one of those ways is through anonymous surveys. So national data suggests very disturbing rates of sexual assault, that 1 in 4 women, 25% of women, will experience sexual assault during their time on a college campus. Men also experience sexual assault. The number for them from the survey data is 1 in 16. Right? So if you think about the women who are graduating in a graduating class, I just finished graduating the class of 2014, right? So 250 women or so walked across that stage. This data suggests that 60 or so of those women experienced assault on the Williams College campus while I was in charge. That's not okay. And 16 men had the same experience. Williams is, as far as we can tell, in line with the national statistics. That means that we need to work harder. And I'm going to tell you a little bit more about that work. Before I do that, though, I want to talk a little bit about not just the prevalence of assault, but its impact on folks who experience it. The experiences of people who experience assault are really broadly varied. The things that they struggle with differ from individual to individual, and they vary over time. They vary from things that can come up right away, like injury, fear, shock. They can go forward into things like panic reactions, difficulty concentrating, a sense of loss of safety on the campus. And they can really lead students to have their fundamental experiences here at Williams transformed. And so I actually had, I set it aside, sorry. I had pulled some words from some of our own students, let me see if I can find them, that I just want to share with you. These are some things that I and my colleagues have heard from students just this year. So a student said, I tried to get back to my normal routine, but I couldn't concentrate in class, and everything I read just leaked out from my head. I went from the dean's list to academic warning in 1 semester. Another student said, I started partying really hard afterwards and drinking or smoking on my own on the nights when there wasn't a party, and I had to go to the hospital for alcohol poisoning. A third student said, I decided that it had happened because I wasn't strong enough. So I was spending 2 or 3 hours a day working out, lifting and running, and that was also the only time that I felt calm. I ended up injuring myself, and then I couldn't play on my team. Just one more of these. A student told me, it happened so early in my first year that I've never really gotten to have any memory of Williams without it. So just to kind of, I know those are really hard to hear, and it's hard to hear those things, particularly about a place that we love. So just give that a minute. And I want to talk now about our work with those students and the students like them in trying to support their recovery. People do move forward from assault. They get stronger. They get towards a better place. But we know that those things happen best if students are connected immediately to high quality and professional support. If they're not trying to manage on their own, and if they feel like they have a community around them, listening to them, believing them, and helping them move forward. So obviously, it's our obligation to reduce these destructive experiences in lots of ways. And I want to talk first about our response, what we do with students who come and talk with us. So when a student reports a sexual assault, we have 3 key obligations in my regard. The first is to ensure the safety of that student as best as we can, and also the safety of the campus as a whole. The second is to support the recovery of that student, again, by getting them to expert support and counseling, whether on campus or off campus, to appropriate medical resources, and to other things that will support their ongoing strong recovery. to get them to the best help. And the third is to encourage them to pursue the processes that will enable us to hold the person who hurt them accountable. And as you know, there are a couple of different kinds of processes. There are processes here on campus, disciplinary processes that I oversee. We'll talk some about those in a little while. And there are also legal processes that students can access by reporting to the police and going through the court system. And we try very hard to get students to take advantage of both of those kinds of processes as they feel ready and able to do so. So one of the key things to keep in mind is that we're going to try to accomplish those things, ensuring the safety of the student, supporting their recovery by getting them to the best help possible, and encouraging them to participate either in disciplinary or legal processes in a way that allows them to retain their authority and their privacy. And the reasons that we do that is because students who have survived assault tell us all the time that an assault is an experience of losing control, particularly difficult experience of losing control, and that one of the reasons students are hesitant to talk about what's happened to us is that fear that they'll lose control again, that they'll have a conversation with somebody just for support and find themselves forced into participating in a disciplinary or legal process, or that they'll tell somebody what happened and that won't be kept private, that will lose confidentiality. Those are big fears that students have. And so while we're trying to do everything we can to support them effectively, we're also working really hard to try to ensure their authority over what happens and their privacy. So reporting, what does that look like? So every time a student tells us about a sexual assault, regardless of what else they want to do, whether they want to pursue disciplinary process or legal process, or whether they don't, or whether they're not sure, there are certain things that we always take up. So the first is to try to get them to the best support. We have a sexual assault survivor services team of staff that includes my colleagues over here, Justin Adkins and Meg Basong, and also Donna Donnelly Hess from our health center. Those are staff who have done really extensive training in supporting survivors of assault and who are available 24/7 to work with a student either personally or to take them to court or to go with them to medical care, anything that they might need, or to walk with them through the disciplinary process. We also get students to medical care locally, or as locally as we can. We have some medical services for survivors of assault at the health center as well. And of course, ongoing counseling, both specific counseling for survivors and our broader counseling services. A second thing we do is to try to make the campus as workable and safe and comfortable for the student as we possibly can. And that set of things is called accommodations. It has different parts. It basically has to do with talking to the student about how things are working for them on campus right at that moment and how we could be helpful. So we ask students about where they're living. Are they comfortable in the housing where they're living, or should we make a housing accommodation? Sometimes students are no longer comfortable in their own room if that's where the assault took place, in which case we'll move them. And we'll move them with a couple of friends if we can. Sometimes students really want to stay in their own room but are no longer comfortable if, for example, the perpetrator of the assault is just down the hall. And in that case, we'll move that person and perhaps some other people as well. So these arrangements, for example, in housing, but more generally, are really personal. Not everybody needs the same thing, and not everybody needs the same thing over time. So one of the things we're doing is going back to students all the time and saying, okay, this is the arrangement we made. Is that working? Are you actually getting the privacy you need? Is that housing space not viable for you? How else could we help? So that's the housing part. We also do academic accommodations. You heard me read the voice of that one survivor of assault talking about the ways her academics had been impacted by the assault because of the panic and the ways that affected her ability to focus. So the academic accommodations that we make are also varied, right? They could include, if both parties are in the same class, making different arrangements, and we make different arrangements typically for the perpetrator, presuming that the survivor wants to stay in class. They would stay in class and we'd move the other person. If the survivor is more comfortable doing an independent study, we'd work that out too, that kind of academic accommodations. Just getting extensions, getting the students some more space to get through what they're struggling with, those kinds of academic accommodations. Those are the sorts of things that we work on that front. And then the third accommodation that we use actually fairly often is a no contact order. And a no contact order is something that we set up between two students. Again, this is separate from disciplinary process. This was without having taken up any disciplinary process necessarily. We've set up a no contact order, which basically tries to create a space where the student who experienced the assault won't be in contact with the person who perpetrated it. So it says that that person can't contact them directly, can't talk to them, can't call them, can't contact them on social media. Often the most important prong of that no contact order is the restriction on contact by third parties, right? You can't send your friends to go and bother somebody, and you can't send your friends to go and bother somebody else's friends. It's a way to try to create a safe space on the campus for a student who's experienced assault but hasn't yet chosen to make their way through a disciplinary process that would remove a perpetrator from campus. So again, those are the pieces of the accommodation and the support. And then, as I mentioned, we talk with students about our disciplinary process and what's available to them there, and about the legal process and what's available to them there. And nobody has to walk through any parts of any of those things alone. Finally, we have obligations that have to do with the safety of the campus, which are trying to find out what happened. And trying to find out as best we can whether there's an immediate safety risk to the campus as a whole, and also keeping records, particularly so that if there's not a disciplinary process at this moment, and then we hear the name of the same perpetrator again, we can act immediately. So that's sort of what that looks like formally written down. In practice, what it looks like is a little bit different, and that's because when people experience trauma, it's often really hard to make decisions and really hard to figure out what to do. So what really happens in reporting typically is that a student will come to see me either alone or with a support person, and they're really sort of uncertain. They'll say, I'm not sure how to name the thing that happened to me. The thing happened to me a long time ago, maybe not yesterday or last week, but last month or last year or in my freshman year and I'm a senior. Sometimes it's a long time ago. They'll say, I'm not sure that there's anything you can do. I'm not sure that I want anything to happen. I don't even really have words for it, but something's happening. And then they'll often say, the first thing I was hoping would happen was that I could just forget, so that I wouldn't be in here talking to you, but that hasn't worked for me, and so now I'm not sure what else I could do. So in the context of that conversation, as you can imagine, we're really trying to explore what would help. And that question about what would help is something that, again, evolves over time. So I try to kind of lay some things out. Well, how is it working for your housing? Would this help? Do you think you might want a no contact order? And often making our way to something that's actually helpful to the student takes time. It might take 1 or 2 or 3 or 4 or 5 meetings. Those students all have my phone number. Sometimes they decide, at 10 o'clock at night that something would help. We make that work. They also have Dave Boyer's phone number so that campus safety can help them 24/7 with no questions asked. So I think it's important for those of you who are less familiar with it to kind of have a sense of the texture of uncertainty and difficulty that can follow for students in the wake of trauma, and the ways that it can be challenging for folks to sort of figure out what will be most helpful to them, and that we try to walk with them through that process. Another thing that's probably helpful for you to know as you're thinking about this work is that process that I just described, the reporting process where I'm trying to help the student be connected to resources that would be useful for them, is relatively rare. Both at Williams and nationally, it seems to be the case that only about 10%, and certainly no more than 20%, of students who experience assault actually report it to somebody. And we know that because of the differences of what we see in the survey data and what we see in terms of students who actually come forward and talk to us. And that makes a lot of sense in certain ways, as you might have guessed from what I described before. When asked about reporting, students often say, I don't want to tell that story again. I don't want anyone else to know. I'm not sure that anyone's going to be able to help me anyway. I'm not fully sure about the words I should use to describe my experience. So there's a lot of reasons that people don't report. But the challenge for us is that if people don't report, we can't meet those primary obligations, right? We can't get them to the best support that will help them with their recovery. We can't make accommodations to try to minimize the impact of assault on their academic work, their sense of safety on campus, their broader well-being. And of course, we can't pursue disciplinary, and they can't pursue legal process if they haven't come forward, and so we can't hold perpetrators accountable. So part of our work here is, again, to try to make the reporting process one which feels both supportive to students and like they're really accessing something that's powerfully helpful to them, to make it worth their coming forward so we can get them to the things that will most support them and their recovery. And that's just, I think, another opportunity to say this is partly why privacy, confidentiality, and giving students their own authority to make decisions is so important. That if students feel that they'll lose that authority, they'll be even less inclined to come forward and report, and will be less able to care for them. Another thing that students sometimes say when I talk with them about their experience, especially if they're telling me about an experience that they had several years ago, and I say, well, thank you for telling me about that, and I'm grateful to be able to try to find some help for you. But I'll say, can you share with me how it is that it's been maybe a couple years, 2 or 3 years, before you chose to come forward? And the students will often say, well, I told one person, I told a friend, for example, about what happened to me, and that friend said, you know what, it's not a big deal. And you don't really want to get into this. You don't want to, mess up someone else's life. These people are all our friends. Just please, why don't you it'll be fine. Just in a week, you'll forget about it. And that happens all the time. And I'm sometimes the second person someone tells, which I think is really worrisome because I'm the dean. I'm not the easiest person to talk to. I have this high up office in Hopkins Hall. So if I'm the easiest person for someone to talk to, then we have huge work to do in the community, right? So one of the things that we talk about in terms of our education and prevention work, and I'll talk more about this at the end, is getting it to, this is one of the goals that I have, that the very first person that any student tells about their experience of assault, whether that's another student, whether it's a staff member, whether it's a teacher, whether it's any part of our community, that person will be well positioned to help that student, to get them to good support, to connect them, maybe just to a confidential resource. They don't have to come see me, but to help them get what they most need by connecting them to the resources that are available both on campus and in the community. So that's part of the ways that we think when we're working on training of all of the student affairs staff, which is one of the things that we've had the opportunity to do in the last 4 years, so that everyone in residential life and the chaplain's office and the multicultural center, the Davis Center and campus safety and the dean's office, that all of those people in the health center are ready to help a student who reports an assault to them. And then working with students so that no student will say to their friend what I just described to you, which is, let it go, just forget about it, you'll be fine, you don't need any help. We just don't want those conversations to be the first ones that students have when they decide to confide in someone. So I think that that's some important things to keep in mind about the reporting part. I should also mention coaches, by the way, are among the staff that we've trained as well, because often coaches and trainers in athletics are sometimes people that students confide in as well. So they've also been sort of part of the student affairs world in terms of that training. So again, as we think about what we can do to support survivors of assault, one of the things we always need to think about is how are we making reporting accessible or inaccessible to students, because if they haven't come forward to us and connected into that web of support, then they're just out there and we haven't been able to care for them or to engage in holding the perpetrators accountable for their behavior. So when students come forward and report, all of the things I described always happen. And then we talk with students, as I said, about whether they want to pursue college disciplinary process or legal process outside the college. And if they do decide to pursue that college disciplinary process, then I'm going to tell you a little bit about how that works. The first thing I should say is that there's not really a time limitation on pursuing the college's disciplinary process. Students often come to me and say, oh, well, this happened a year ago, so I don't think there's anything you can do about that. And that's not the case. As long as the person who committed the assault is still a member of the college student body, as long as they haven't yet graduated, we can pursue the disciplinary process. And the same thing is true on the legal side, by the way, that the statutes of limitations there are long as well. So what does a good college disciplinary process look like? It's easy to come up with the words that you would want to use, I think, to describe it. You want it to be private. You want it to be effective, you want it to be supportive, right? So that it doesn't feel like a terrible traumatic experience just to go through that disciplinary process. You want it to be fair to all parties and respectful for all of the students involved. And there can actually be some internal tension there, for example, if you think about investigation, right? A high-quality investigation is one where you're getting to a lot of detailed information that will help you understand what really took place from all parties involved in the investigation. It's also true that it's really hard for the students involved to talk about what took place. To talk about traumatic experience is hard. To talk about sexual experience is hard. To talk about traumatic sexual experience, the joining of those two is extremely hard. And so one of the things we've changed through the result of long conversations with students that started about 2 years ago now, actually, is change the way we do investigations. We're now using professional external investigators who do this as their core work, who come highly recommended from other institutions, and for whom working with students around these very difficult conversations, but very important conversations, is their core everyday work. Students prefer that and explain to us that they preferred it, not because necessarily we were not doing a good job of investigating, but because that additional privacy of working with someone who comes here just to do that and who isn't also your dean for your academics or the campus safety officer who might be helping you unlock your door, having a more private place to have that conversation with students, something that students very much wanted. And so we feel very fortunate that we've been able to put that change into our process. We also then, the next step once one has completed that investigation is to adjudicate, right? And you may have heard that adjudicating these cases under Title IX, which is the federal law that oversees them, requires weighing what's called the preponderance of evidence, right? So weighing the preponderance of evidence means that you're looking at every part of all of the accounts and you're trying to determine whether it's more likely than not that a violation of the college's code of conduct took place. Okay? So it's a weighing of evidence, and it's more likely than not standard. Sometimes people are a little bit unfamiliar with that. So we adjudicate that. The adjudicators are a trained pool of student affairs professionals within the college, including deans and other members of the community that are trained especially to do that. And I'll just mention here what our code of conduct actually is. So our code of conduct, as I said at the beginning, requires freely given and clearly expressed consent for all sexual contact. That's a piece of it. That's the core part. And any violation of that is what we call a sexual assault, as I started from the beginning. There are actually two other pieces of our code of conduct that are pertinent to what we call sexual misconduct. One is sexual exploitation, right? Which is something that people don't always think of, but is actually equally violating, right? That has to do with taking photographs, making videos, with coercion, with blackmail, with all of the different kinds of ways that somebody, without actually touching somebody else, might violate their integrity in ways that have to do with sexuality. So sexual exploitation is itself a separate violation of our code of conduct, and we adjudicate those cases in the same way. And then retaliation is also explicitly forbidden. So one of the things that students talk about when they're expressing concern about coming forward to report or through our disciplinary process is concerns about retaliation, concerns about what they'll call backlash. And that has to do with somebody making life harder for them because they reported. Retaliation, if it happens, either directly from the person accused of assault or from their friends, is its own violation of the college's code of conduct. We investigate those and adjudicate those themselves separately when they're brought forward to us. And we think that's a very important thing. It's actually something we talk to students about as we're supporting them through these processes, like what's happening in the background, what else is going on, you know, are things coming up that we don't know about, and that's one of the issues that we talk about a lot. So at the end of the process, obviously, you come to this determination of whether or not there was a violation of the college's code of conduct along any of these dimensions, and then you come up with sanctions. Our sanctions all involve separation from the college for these kinds of concerns, either suspensions or expulsions. All the ones that I've done in the last 4 years have turned out that way. But we don't have mandatory sanctioning. We weigh the particulars of the particular case and then come up with the sanctions for each case on their own. But that's the kind of sanction that we always land with. So that's the college disciplinary process, and as I mentioned before, no student has to go through that alone. For every part of that process, including the investigation, the student can bring someone with them. Typically, again, one of the members of our sexual assault survivor support group, but they could also bring another teacher or a chaplain or another dean with them, whoever they felt was most helpful to them. We also are available in the same ways to support students through the legal process. Obviously, we don't control the legal process, but if a student does report to the police and want to go through that process, one of the hardest things is going to court by yourself, and we never let that happen. Unless the student really wants it. We go with them, we help connect them to victim advocates, we try to make sure that that process is itself as welcoming and as manageable and as undisruptive as it can be. So that's a little bit about sort of our response to the assaults that have been reported to us. What I want to do now is just take a few minutes, maybe 5 or 6 minutes, to talk about our education and prevention efforts, which I actually think are equally important. And I'm sorry to give them a little bit shorter time. And then I want to have some time for you all to ask questions, because I'm sure you have some. So as I mentioned, I think preventing assault, ideally, is the core of this work, right? Ideally, we would be making a universe here where assault just doesn't happen. There's a lot of work behind that, and there's particularly a lot of work behind that because we get new students every year, right? So even if we were able to be sort of fully effective in our transformative conversations with students, there 550 new people come every year. And they come with this very wide range of beliefs and understandings and experiences in their own intimate lives. One thing that's worth being aware of is that a lot of students come to college already having experienced assault. So that same survey that shows us that about 1 in 4 or 1 in 5 women students experience assault while at college, that most recent survey is saying 19%, shows that almost the same fraction, actually 16% of women experience sexual assault before they come to college. So this is not a problem that somehow only happens on college campuses. It happens in larger communities where we have a particular opportunity to care for survivors and to enact education to make it better than that here. So our principles when we're looking at education are obviously that we want to prevent perpetration, we want to prevent victimization, we want to reduce risk factors, and we want to use as much as we can research-based and evidence-based methods to do that, to get people to think differently. One of the things that we know in the public health world, which I've learned about because I'm a physicist, not a public health person, but in the public health models, people talk about all of the different arenas in which education needs to take place in order to transform a sort of community-wide public health problem, which is really what this is. You need to think about individual education that's around personal decision-making. You need to think about the decisions that happen in small groups, like a couple or small groups of people. And you also need to think about community-wide education and community-wide standards. And we're trying to do that work on all levels. And as I said, this is really ongoing work. On the personal decision-making level, you're helping students try to understand things like what is consent? What does respect within intimate relationships actually look like? Is silence consent? No, it is not. But how many high school students know that? Not most of them. I have a high school student, so I know that. He knows that. I tell him that all the time. Like every day. So truly, if he were here, he would tell you. So there's those kinds of questions, right? And similarly, what does it look like to say no? Are you able to say no? What does it mean to have boundaries? Is it okay to have boundaries? Those kinds of questions. How do respectful, intimate relationships make their way forward? And then other kinds of personal education, like where could you get help? Who could you safely talk to? Who is a private resource on this campus? How could you help a friend? Right? Those kinds of education is part of what we're responsible for. And then education around community standards and social norms. What do we expect of one another on this campus? What is okay within the Williams community at large and what is not? And then also what is okay within our smaller communities. All of you who went here were part of Williams as a whole, and you still are, but you were also part of these smaller communities, right? You were part of a team, or you were part of a house, or you were part of a cappella group or something. And each of those little communities has its own social norms and social values. And so we know that we need to work within those small units around the ways they work, as well as across the community as a whole. And so these kinds of education and awareness work that we want to do, some of them are uniform, so there are certain things I'll tell you about in a sec that every first-year student has to participate in. It's the same for everybody. It's kind of the bottom line stuff. And then there's other things that we really should be tailoring, right? And thinking specifically what will be most effective for first-year students, what will be most effective for a particular team, what do we most need in a particular cultural context. So that's kind of the way our current work is structured. To give you a little bit of concrete aspects of it, so first-year students are the new people we know the least about. We work with them during first days. Actually, on the second day of first days is sort of largely devoted to sexual assault prevention and response work. We have an hour-long presentation that all the students participate in that actually is mostly involving student voices, although it also has me explaining concretely what is permitted and what is not, and what the resources are. And then they break up into small groups where they're working with their JAs, who are now really extensively trained on this subject as well, and I could talk about that. They do either half a day or a full day of training with professional thinking about keeping first-year students in their entry safe and all of the associated pieces of that. And so they do those small group conversations with those JAs, with Rasan leaders, and with others. So that happens in first days. Some of you may remember that not everything you heard in orientation took completely. Perhaps you remember that. So we also know that we're talking to students about social norms and intimate behavior when they're coming from all of these different places and they're in the midst of being immersed in a whole new social world that they're unfamiliar with, may not be the most effective. So we come back around to them again over the course of the year. There's a second whole wave of mandatory programming discussions that happens in February. And those conversations have a bunch of aspects. They have to do with keeping yourself safe. They also have to do with what we call bystander intervention training, which is a model that's important in this work in many places, including at Williams. It has to do with the idea that some of the most important things that students can do is be aware of behavior around them that may be risky, that may be leading towards an assault, and find a way to probably get together with somebody else and safely intervene. So to notice and to intervene. We start that work with first-year students in first days, and it continues on in other contexts with student leaders and with others over the course of the 4 years. And I'm happy to talk more about that if people are interested. And then, as I mentioned again, work with teams and with captains and coaches around those particular communities is something that we've been building some and that we'll be launching more additionally next year. So in the next a couple of years, as we're continuing this work, sort of the near horizon, one of the things that we're going to be doing is starting a review of everything we've sort of built over the last many years, and particularly over the last 4 years, to see what's working well, what needs more work, and how we should change that. And a lot of that work is going to be led by our new Director of Sexual Assault Prevention and Response, which is Meg Basong, Williams class of 2005. A 4-year Rasan member and crucial leader of statewide and national work on this front from the Boston Area Rape Crisis Center. So we're going to be looking at everything we do. So our prevention work, surveying students, what do they actually know about consent? We know what we said. We don't know what they learned, right? We don't know whether there are particular pockets of students who might have learned things really fully and others for whom that information just bounced off and didn't take. That would help us modify and add to our educational initiatives. We also want to talk to students about reporting, right? What's working for them for reporting, what's not, about the disciplinary process, what's working, what's not. What are the social pressures that are making it hard for students who do report and hard for students who don't report? So these things have to do with surveys, they have to do with focus group conversations, they have to do with community-wide assessments. There's a lot of work ahead of us to figure out how the changes we've made have actually taken and what work remains ahead of us. We know that there's a lot. I think, and I'll just close with this, I think for me there's a really hopeful place here around how we may be able to move this work forward that kind of comes from two somewhat new things. One is the new national focus on sexual assault, right? It's on the front page of the New York Times all the time. And I think one of the things that buys us actually is some new national work around best practices, particularly in education and in prevention, so that we're not just trying to figure out how to teach Williams students effectively, because we need to do this fast, right? They get here, we want them to understand this right away. Best practices on education would be very helpful to us, and there's more research on that now than there ever has been. I think the other thing for me personally that's really hopeful is the engagement of the campus and the Williams community as a whole. So you're all here, which is actually terrific and really inspiring. But also what's true is that the student engagement in this work is, I think, broader and deeper than it ever has been. So, you know, there have always been students engaged in this work. You know, that's been true for many, many years. But now it's not that there are small pockets of students engaged in this work. You know, Rasan is a famous group and has been here for many years and very powerfully so. And Rasan continues to exist in powerful ways, but now, and that group is no longer all women, it has lots of men in it. There's also a men's group called Men for Consent. There's lots of women in that group. There are teams doing really effective work on this and really, really interested in this. Faculty are engaged in this work. The College Council is engaged in this work. We actually created a new committee called the Sexual Assault Prevention and Awareness Group 2 years ago, which is a staff-student collaboration on this work, because we realized we needed to pull together these 17 different student groups and committees who were taking up as a part of their core mission doing work on this front. So that's complicated and it's terrific. That breadth and depth of student engagement is just the only way that you can change culture, and we're so grateful that our students are working on that as a whole. You know, I think on the other side, the first year that I was dean, which was 2010, President Fox stood up in front of the faculty meeting, which happens in this room, and talked about sexual assault. So I had been here before that for about 15 years. No president had ever talked about sexual assault in the faculty meeting, right? The faculty meeting, you talk about curriculum mostly, and talk about faculty politics, which is not really interesting. But that's what he did. He said, you know, this is before the Dear Colleague letter. This is before before Joe Biden was talking about this in 2011. Certainly before President Obama was talking about it. This is all before that. It's a chosen focus of President Fox, which is partly why we were able, for example, to hire Meg to focus solely on doing this work on the campus. So I think from all directions we have resources and brain power coming towards this, and my job is to try to kind of corral all of that and help use that again to enact a stronger and safer community for our students.